Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight, just like every night, we're going to get to lots of questions. But
Hello,
first,
thank you for tuning in.
I want to say hi to you, Mom and Dad, Dr. McDougall and Mary. How are you? Nice to see you.
Good.
Doing good.
I know you have lots to talk about tonight. We have lots of questions as always, but I know there's some studies you wanted to talk about. So I'll get those.
Well, I spend the week, and I get stimulated by different topics, and as the week went on, I kind of decided what I wanted to talk to you about tonight, and I'll go through how I decided and why. All right, so are we sharing okay?
Perfect.
All right. I've talked to you, we've got to start a lot of our meetings with a discussion that there is one big elephant in the room, and that's the semaglutides. I mean, the drug companies, Eli Lilly and Novo Nordisk, they own everything, and they're planning on changing the economics of the entire planet and basically being the most powerful company in the world because they're dealing with the biggest health problem in the world, which is obesity. And so they've got drugs, they're called semaglutides, Ozempic, Wegovy, Zepbound, and what's the one you keep remembering? Anyway.
No, we'll go Mounjaro.
Mounjaro, there we go. And then they got a whole bunch of them coming out, a lot of new ones. Basically, they own the patents, these two drug companies do. They do all the research. And what I want you to know is what you're looking for in terms of these semaglutides, you won't find. You won't find a healthy program with permanent weight loss, but you will with the McDougall diet. And I don't want to be shy about it, but this will give you everything that the semaglutides promise with a catch. And the catch is the horrible, horrible side effects and costs. If you look at the weight loss, and we have data on this, we have published data, and remember, their studies are published by these two drug companies. But the average weight loss in our program is 22 pounds in a year. Theirs is 25. But we started out in our group with a higher initial weight, or they did. They started out at 233 pounds. So they're going to lose a little bit more. So let's just say we lose the same amount of weight. As far as reaching a plateau, we don't reach a plateau. You lose until you hit trim body weight. Because the hunger drive wants to keep you alive, you reach a plateau at about 68 weeks, and you've lost only 37 pounds, and it's cost you $17,000. And the way you've accomplished this is by making yourself sick with injections that you give once or twice a day or once a week, or take pills. And these injections are derived from the poisonous venom of a reptile, as poisonous as a rattlesnake. They're the Gila monster. It lives in the Southwest United States. And they've just figured out how to prolong the toxicity of a Gila monster bite. Basically, that's what they've done. As far as adherence, well, the data shows that on the semaglutides, only half the people are still on the program. But we've got published data that says that 85% of the people who learn our program stick with it for a year. Yeah. Side effects, we have none, except for a little gas. They have horrible side effects, and some that'll even kill you. I'm talking about past the desired side effects, which are nausea, vomiting, diarrhea, stomach pains, which is how they get you to lose weight. They make you sick. And then they have some horrible, horrible cancers and all kinds of problems associated with these drugs. And I have to admit, I don't mind admitting, they're in a rare number of people, but if you're the one that gets these particular severe problems, you're gonna say it counts. It's 100% for me. The program we teach is planet friendly. In fact, this will cut greenhouse gas production individually and also by the agribusiness. All they do is they cut back a little bit on the amount of food you eat, but you're still eating the planet destroying foods. And those foods are dominated by animal products. And you know how we feel about cruelty in the stockyard. Now, I added some other things for you last week. Like, this is particularly troublesome from older people. They have more falls, more side effects. And part of the problem is that you lose your muscle mass. They're documented. You lose muscle mass when you get on these semaglutides. And you've heard me talk about the data of some of our known athletes, like Carl Lewis, who set the world record for the 100-meter dash and holds still all kinds of records, fastest man in the world. And yet what you can expect with these semaglutides is to lose muscle mass. You lose your appetite for some things you might enjoy, like tobacco and cocaine and alcohol, coffee, even, and sex also. You lose your desire for sex when you take these drugs. Anyway, I just wanted to review those things for you. Heather has a chart that she's going to make available for you. And you can show your friends this and say, which would you rather do? I know what you want. You know, I know what you want to get down to trim body weight. You want to look good, feel good, be strong, smell good, etc. I know what you want, but these drugs are not going to give it to you, at least not by cheating terribly, cost you a lot with a lot of side effects. But there's one thing I had to add to the chart this week that I forgot about, and that is that these drugs are contraindicated in children. Yeah, that the American Academy of Pediatrics came out just a few months ago, February 2023, and told doctors practicing around the country that you could do bariatric surgery, that's the weight loss surgery, on children after the age of 13. You can't start these drugs, the semaglutides, in children until they're 12. After you wean from mother's breast, you start on the McDougall diet. I know you're concerned. Okay. What captured my attention this week, and it's a roundabout story, but I think I can deliver it, was this particular article in the Washington Post. Study suggests link between air pollution and Alzheimer's. Well, you know, that was interesting. Air pollution and Alzheimer's. Well, the only thing that I know that pollutes the air in Alzheimer's is aluminum. And actually, aluminum is put into the atmosphere in huge amounts, you know, by industry, but they're also planning on reflecting solar light. Solar geoengineering, they call it, where they're going to shoot aluminum particles up into the stratosphere. And they're not going to stay in the stratosphere, folks. There's going to be a lot of aluminum all around you in the air and the water, et cetera, to reflect the sunlight, to save our planet.
Oh, no.
Yeah, well, that's one of the things they propose. But I taught you the right way to save the planet, and I want you to, if you haven't done it last week, I want you to do it this week. I want you to look up MEER.org, MEER. They use aluminum. Yes, they do. But they use it to make mirrors, and it never gets in the atmosphere. They take aluminum cans along with plastic bottles, and they convert them into mirrors. Currently, it's using fossil fuel, but they got it worked out that they can use solar energy to make these mirrors, and they cost about $10 a piece. And if we cover a reasonable amount of our planet with these mirrors, we can reflect the sunlight. It's called mirror. It's our only chance. Anyway, get on with the topic of the day. The topic of the day is aluminum and Alzheimer's. Alzheimer's disease, dementia, 60 to 80% of the people who become demented, it's from Alzheimer's disease. The other ones that become demented would be things like alcohol or small infarcts, or cerebral infarct, strokes, Parkinson's disease, et cetera. The way you diagnose Alzheimer's is by a history. And the history tells of somebody who becomes demented and quite rapidly goes downhill. There are no tests, there are no blood tests, there are no PET scans, there are no CAT scans. I mean, these you could do, but they're not very accurate, and they don't really make a diagnosis. You make the diagnosis by looking at the brain tissue, Alzheimer's disease. Louis Alzheimer, he discovered the first case of Alzheimer's disease in 1901. And what he did is he found this lady who was rapidly progressing in her dementia, very quickly, quicker than the other patients he was taking care of. And after she died, what he did is he did an autopsy on her. And he put some of her brain tissue under the microscope. They had microscopes back then. And he found a distinctive plaque called a neurofibroblanco. In 1901, he discovered this. Anyway, that was the first case. Then by 1926, there were 33 cases. After World War II, during World War II, they started using aluminum. Prior to that, it was too expensive. They didn't have good manufacturing processes to put the aluminum to the utilization that we've used it for today, airplanes, pots and pans, et cetera. But anyway, during World War II, we discovered how to manufacture aluminum in large amounts at a reasonable price. And subsequent to that, 24 million people were diagnosed with Alzheimer's. 57 million Americans were expected to be diagnosed in 2018. And by 2025, they expected to be 7.1. It's rapidly progressing. Can you imagine if we would start polluting our atmosphere with geoengineering? No, we can do it, but with aluminum cans and plastic bottles. The problem, of course, with this approach, it'd be big business to send aerosols up in the atmosphere, or to take it and put shade, like I showed you last week, to shade some of the planet to cool it off. But there's not a lot of money made in collecting bottles and cans, is there? And that's the big problem. This is a volunteer organization. Anyway, getting back to Louis Alzheimer's and the Alzheimer's disease, and why we don't want to do bioengineering and stick aluminum in the atmosphere. And there's already plenty of aluminum in the atmosphere, thanks to industry. If you would like to understand how aluminum causes Alzheimer's disease, I think I put 4 articles in the references for you. Here's a couple of the recent articles that have been published on how aluminum is toxic to the brain. And it shows you the research, the animal studies, the patients who had kidney disease and how they developed dementia, on and on and on. It talks about, well, let's look at the evidence. The first thing that you want to look at is you want to look at the brain. And you do this with a microscope. That's what Louis Alzheimer did in 1901. And these are the plaques and neurofibril tangles that he discovered in his patient in 1901. These plaques, you see these brownish colored sort of circular things. These are plaques. They're like scars. And then the neurons are the purple ones. There's the nerves. And inside there are fibers that are disrupted. We call those neurofibril tangles.
So the ones on the right side, right there, even they have stuff on them.
Right. You see the inside protein on the left picture.
Yeah,
There's no tangles.
right.
But because of the aluminum poisoning, if you look at the right frame, you see the tangles within the purple nerves.
Yeah, but they're
And the-
not, they aren't sitting inside.
These are the
They're,
deposits.
they're sitting inside too.
They're sitting in the brain tissue. They're
Okay.
outside the nerve cells.
And they're also on top of the purple things?
No, they're sitting in brain tissue next to the nerves, which are the purple ones.
Okay,
Okay, there are nerves in here and there's just brain stuff.
okay,
It's like the pudding in a jar.
okay.
All right. So the result of aluminum poisoning is you get damage to the inside of the nerve cells, which results in neurofibril tangles, and you get the deposition of these plaques called senile plaques. These lesions are called pathognomonic. In other words, when you see these lesions, you name the disease. If you don't have these lesions, you don't have Alzheimer's. That's absolutely necessary for diagnosing it. All right, well,
But the problem is you can't find out until after you're dead.
unless you have a brain biopsy.
Oh,
You always have a brain biopsy.
well, I wouldn't think, I don't think that'd be a very good idea.
It's all right. The connection that people have made with diet so far in Alzheimer's has to do with the Western diet. We find that people who eat the Western diet, like for example in Europe as compared to Asia, they have many more cases of Alzheimer's. You compare Japanese Americans who live in Hawaii with Japanese who live in Japan, you find the same thing. Those who live in Hawaii, eat more of a Western diet, have more Alzheimer's. And this goes on. Countries with high fat, high cholesterol diets have more Alzheimer's. And so there appears to be a connection. That connection may be that the Western diet is an acid-forming diet. I'm not going to go into the details, but if you want to read the research, you'll see it there. And acid from the meat, from the dairy, actually increases aluminum absorption in the gut. So there may be the connection which ties Alzheimer's back into it.
Ooh,
Yeah. All right.
okay.
So then you get down to the aluminum part. In 1973, what they did is they ground up the brains of people who are suspected of dying of Alzheimer's and compared to, say, people who died of strokes. And what they found is a much higher content of aluminum in the brains of patients who died of Alzheimer's. Animals, you can create these lesions, these pathognomonic lesions in animals. by exposing them to aluminum. We find that in populations where they heat, they drink water that has a lot of aluminum in, they have more Alzheimer's disease. Anyway, the way that they really discovered this was they invented the electron microscope, and they were able to dive deeply into these plaques. Okay, they were able to dive deeply into these senile plaques, amyloid plaques they call them here, and slice them and go down in detail. And they found that at the central core of the senile plaque is a core of aluminum silicate. You know, follow my thinking. And this is the way everybody should be thinking. You don't have the neurofibril tangles and the senile plaques unless you have the central core of aluminum silicate. You don't have Alzheimer's unless you have the senile plaques and the neurofibril tangles. I mean, how much more of a connection could you have? Anyway. How do you get aluminum? Well, pots and pans, various mixtures that you buy off the shelves, like cake mix and muffin mix, etc. Baking powder, some of it comes aluminum free, some you buy with aluminum. Plant foods have very little aluminum in them. And if you take a look at your cooking methods, that will determine how much aluminum gets into your body. If you cook in aluminum pots and pans, guess what? You intake a lot of aluminum. Whereas you cook your food in, say, stainless steel or glass or porcelain, you don't find this rise in aluminum. That's what you see in the chart in the bottom left-hand corner. The other thing that'll come up for you is the fact that tea, you know, the kind of tea that you drink, tea has a lot of aluminum in it. But the aluminum in tea is complex, so it's not absorbed. It's safe. Okay? The other exposure to aluminum, and one that's more important, has to do with exposure through the nose. And we started this conversation about talking about aluminum being in the atmosphere causing Alzheimer's disease, and this is where we're ending up, folks. It used to be industry when people worked, say, automobile plants and made brake linings. One of the things that happened was aluminum was dispersed in the atmosphere, and they breathed it in. Okay, the people who have the worst disease, the worst Alzheimer's disease, have the greatest numbers of senile plaques in a stalk of the brain called the olfactory lobe. You see it down here, stalk of the brain called the olfactory lobe, so that the aluminum passes from the air into the nasal cavity, and it's absorbed through this stalk of the brain. And if you examine people who have very severe Alzheimer's disease, you see that they have the most senile plaques in the stalk. In other words, the most serious portal of entry is through the nose. All right. You want to read more about it? Aluminum and environmental pollution, the silent killer. Great article. What do they say? Furthermore, most antiperspirants contain aluminum compounds that raise human exposure to aluminum. And that's the point I was trying to make here with you, is that it used to be industry. It used to be, just plain old atmosphere. But what happens is people use antiperspirant deodorants. And to be an antiperspirant, you have to have a compound called aluminum chloride. All antiperspirants have aluminum in them. The aluminum stops the perspiration. This is not the same as deodorants. Deodorants don't stop perspiration. These are antiperspirants I'm talking about. They went out of phase about 15 years ago when this became part of the press. People were learning about it. Now they're back in popularity. So there are lots of
We got a lot of new ones.
out there. Be careful. All right. So anyway, what we're talking about is, you want to read a good scientific article on how aluminum in the environment, particularly in the atmosphere, including spraying your nose with antiperspirants, raises your exposure to aluminum. And they say in this article that means you have a higher risk of Alzheimer's. All right, so what do you do about it? Well, one thing you could do right now, safely, no cost to you, is you can take in silica. Okay, silica. It's not silicon, it's silica. Silica is a compound.
From
Okay.
Green Mountain
Yeah.
Tea. Oh, I didn't know
If you see-
that.
Yeah, if you see here, silicon is an element, okay, it's Si. Silica is a compound that contains oxygen along with silicon. Anyway, silica is found in various teas, like mountain tea and bamboo tea. There are a few different teas that are really high in silica. You could buy silica powders that you can put in your drinks, or you can find silica water. Here's a couple of brands right here. And it's a little, as 10 milligrams a day of silica is associated with a reduced risk of Alzheimer's. This bottle contains 86 milligrams, or maybe it's not a liter. What do you think? Is that a liter?
Oh, no, that's not a
Okay,
liter.
so it's a half a
It was
liter. Okay, it's half that, 43 milligrams. And it takes only 10 milligrams to show a benefit. Not going to do you any harm. So you want to stop eating aluminum. I don't know how you can stop breathing aluminum except for stopping the antiperspirants. And you want to get rid of the aluminum in your body. And silica's a safe, non-toxic, extremely inexpensive thing to try. All right. The other way we deal with this is through a drug called deferoxamine. And there were studies done in the 1980s where they took Alzheimer's patients and they gave them injections of deferoxamine. And they got better. They got a lot better. In fact, when they compared to placebo, the deterioration was only half as much as those who didn't take the drug at all. 50% reduction in progression of disease. We have 2 new drugs out. I need to talk to you about them because they're being promoted. You're being lied to about these also. A good share of my medical profession knows you're being lied to. And they put great efforts into stopping these drugs being released to the public. But, drug companies got the money. And so there are a whole series of new drugs called monoclonal antibody drugs. Leqembi is one of them, one of the first ones that came out. They did an 18-month trial in 2023 on Leqembi. And what they found was a 27% slowing of the disease over a 2-year period of time. Excuse me, deferoxamine got a 50% reduction in the progress of the disease. This drug only got a 27%. And the new drug that they came out, another variation of monoclonal antibodies, said it only delayed progression by 4 months. That's the positive side. That's what they're promoting. That's a unique position. Hey, come on, and I'll tell you, we reduce the risk of progression of your disease, not by a lot, but by a little bit. We reduce significantly. Oh, and by the way, if you took deferoxamine, you get even better results at virtually no cost, no side effects, or no serious side effects. And removing the aluminum from the body is a cure. These are not cures. These are somehow affecting part of the pathology with these monoclonal antibodies. They get in and they actually take care. They're supposed to eat up the neurofibril tangles I showed you about. The price for taking these drugs, in addition to the fact that they don't work well, is 20% of people suffer serious brain injuries, including bleeding. 20%. And the cost is like $26,000 to $52,000 a year. It's money. That's basically this money. All right, that's enough. Go ahead, ask your questions.
Okay, that was good. That went fast. I put all those research articles in the notes so you can do some more research if you like. Also, if you'd like to learn more about Alzheimer's and aging, we have a whole anti-aging course on our website, and I put a link in the chat where you can get 25% off that course right now if you're interested.
Oh, that's nice.
Oh, yeah.
Well, I have a lot more to say about aging, folks. Let me tell you, I've got 2 hours of discussion for you on aging. But this is just part of it, the aluminum Alzheimer's picture. And it's a topic of discussion. People are becoming well aware that the atmosphere is polluted. One of the pollutants is aluminum, and we could be making things worse by trying to save the planet. There's a better way. There's a better way. Look up mir.org, not mir.com. It's mir.org, O-R-G. Our only chance. In addition,
Okay.
we've got to cut down on fossil fuels and transportation. We've got to make the world vegan too. So let me add some additions there.
All right, you ready for some questions?
Yeah, go ahead.
We've got lots coming in. The first one's from Rebecca. She wants to know what the tests are for fatty liver disease and what plant-based eating does to change this.
All right. Fatty liver is just the deposition of fat. Instead of under your skin, or in addition to under your skin, it's your organs accumulate fat. That's all it is. You know, it's just like the fat under your skin. The fat infiltrates the omentum, which is a big apron that's inside the abdomen. You get all kinds of fat in the abdominal cavity. Infiltrates all the organs, your skin, your brain, everything. And what happens is the liver accumulates a lot of fat. And the fat is irritating to the liver cells and it causes inflammation. The way you diagnose it is you don't very often have pain in the liver, which would be in the right upper quadrant. You'd have a blood test done. Well, first of all, I can just look at you and I have a good idea whether or not you are a candidate for fatty liver. What will I be seeing? I'll be seeing an overweight person who's depositing fat every place, including the liver. And I'll likely see somebody who has type 2 diabetes. About half the people who have fatty liver also have type 2 diabetes. Because it's the same cause. It's the rich Western diet. So you get some blood tests, like they're called SGOT and SGPT, and there are several different tests, GGT, that you can get that measure liver enzymes. They're just simple, inexpensive blood tests. And then what the doctor might do is do some type of imaging on you, like an echo, which are just sound waves, or a CAT scan or an MRI. And they'll see there's a bunch of fat in the liver. And how do you treat it? Well, there's a study I showed you, well, maybe I'll show you in the lecture we have coming up that Heather was talking about, but I have shown it before, where they tried to correct fatty liver disease by feeding good fat, fish fat, omega-3 fats, flaxseed oil fat. Guess what? They didn't get better. No, the fat you eat's the fat you wear. They were just replacing cow and pig fat with flaxseed fat. That's all. Still fatty infiltration of the liver. The way you do it is you just change your diet. You lose weight. The fat comes out of the liver just like it comes out of your thighs and your abdomen, your buttocks and your cheeks and your earlobes, etc. It just goes away. You burn up the fat. It's 100% curable, but it could leave a residual because of all this inflammation caused by the infiltration. It results in the formation of scar tissue, which means some of the liver cells have been killed and they've been replaced by scar. And so you have cirrhosis, which is scar tissue in the liver. And they tell me that it could be fatal. I've never seen such a case, but certainly lots of doctors are talking about these days. Easy cure, just fix the food. And of course, the easiest way to lose weight is semaglutides, right? That's right.
But I wanted to bring that up.
All right.
Because we tend to, joke about things. And when we watch TV, and this happened last night, we were watching a program and a person that was usually associated with being overweight.
60 pounds at least.
Dad said to me, Dr. McDougall said to me.
No, you call me Dad. Yeah, no, that's your dad.
Not your dad.
Forget it.
John said to me, I wonder if that's
the result of
Ozempic. We just call it Ozempic loss, or
it's these people have been struggling to lose weight forever. All of a sudden,
voila! They're thin.
Yeah, what we'd like them to do, of course, is to do it right. Costs nothing, no side effects, cut your food bill 20 to 80%, no plateaus. You become a better athlete. It doesn't hurt muscle mass. Sex life, your desire for alcohol, cocaine, tobacco, and caffeine are still high. It's not the easy way. This is the easy way. Taking a shot once or twice a day or once a week and spending your time in the bathroom.
That sounds much easier.
You think going in the bathroom, throwing up all
Well,
day
no,
long?
that, they don't tell them about that part. They find that out later, and that's when they quit.
A lot of people, most of all, half the people can't take it. They quit. Their compliance rate at the end of the year is 50%. Ours is 85%. Documented. Yeah, without bias, 85% of the people who start the McDougall program
We have to, we.
are
people
still
that
following
eat
it.
The way we do have to learn to eat new foods and to like new
Well,
foods.
you have
So
to
it-
learn to like to throw up.
Mm,
No, I understand what you're saying. It's just like I've always said, Mary, you think changing your diet, you think eating oatmeal and bean burritos and rice and mushu vegetables is hard. I don't think it's hard. What I think is hard is when you get on an airplane, you have to ask for a seatbelt extender. I think what is hard is when you go to a clothing store, you have to ask for the big boy and big girl sizes. I think that's hard. To face the world 30, 40, 50, 60 pounds overweight. Eating oatmeal is not hard. So don't give me this nonsense. It's easier. People initially think it's easy. It's not. And I assure you, after 12 days, which we take people through a 12-day program, certainly after a month, you're going to look back and you say, I don't understand why I didn't do this before. This is so simple, so easy. I enjoy the food so much. That's why 85% of the people stick with the program. The results are phenomenal. And they love the food. Yeah, we can get into that later.
Yeah.
I guess. Anyway, that's what you do with fatty. It's fatty infiltration, just simple fatty infiltration. It is what it says. It's what it says it is. It's fatty infiltration.
So you lose weight and it goes away?
Always. Always. You can imagine, Heather, you got this big person, say they're 80 pounds overweight, and they've got 5 pounds of fat infiltrating their liver. You put them in a prisoner of war camp. I'm not trying to equate our diet with a prisoner of war camp. No, sirree. I'm just trying to give you the extremes of the situation. And you're fed a bowl of rice and a couple of vegetables every day. What do you think would happen? Sometimes, occasionally. What do you think would happen? You look back at this person 6 months later, they've lost 60 pounds and more. And where do you think the fat in their liver's gone? It's gone to supply their daily activities because there's no other fat around. It gets burned up to stay alive. It's 100% curable. But remember, there may be a residual left, and that's scar tissue. So don't do it.
Thank you. Okay, next question. This is from C1 Collector. They're wondering if there's anything that you would prescribe to reduce cholesterol and triglycerides.
Yeah, the food. Folks, am I on planet Earth? The food drops. Our results are, we studied 1,703 people. Triglycerides on average did not go down. But some people drop their triglycerides 300, 400, 500 points. The general group, the triglycerides go up a little bit when you switch to this kind of diet. Never in the abnormal range. They just go up a tiny bit because you're eating better. But the cholesterol, we've published data. In 7 days, the average drop in cholesterol is 22 milligrams per deciliter. At the end of the year, people have still kept their cholesterol down the same amount, 20 milligrams per deciliter. So we've got 2 studies that show that people maintain these benefits after a year. All right, so I think
Is this person asking if there's something you would prescribe?
I think so.
I think so. So I was going to rephrase the question and say, is there a case where you would prescribe something for cholesterol and triglycerides?
Yes, you have to realize some of it's based upon my biases. I was trained a certain way, and I have to tell you, folks, it sticks with you the way you learn to practice initially. And of course, I was raised in the age when statins were commonly used. And we used to believe, doctors used to say, my friends and colleagues used to tell me that heart disease is so common that the way to take care of this worldwide epidemic is to put statins in the drinking water, just like we do fluoride. They saw it as that much of a cause and effect relationship, but they were wrong. The studies that are being published now, after years of evaluation, where we really have what happens to people. Do they have heart attacks? Do they have heart surgery? Do they die? You know, now that we have the long time data, we find that statins do almost nothing in terms of the things you want. The benefits are extremely small, not what it was advertised as. So do I still prescribe statins? I do, but only in people who are really sick. You know, if you've had a heart attack, a stroke, heart surgery, terrible heart scan, then I will lean towards you being sick enough so that even a little bit of benefit will show up. The problem with treating people who are well is because the benefits are so tiny, you can't see them. All right. So if I have somebody who has that condition, I'll put them on statins. If they say, I don't want to take statins, they won't get an argument from me because the benefits are so small. And plus I worry, Heather, Mary, I worry folks, when I hand somebody a prescription for statins that they're looking at me and saying, well, if you really believed in your diet, you wouldn't hand me this prescription. And so I think it takes some of the believability out of what I teach.
Well, there are also side effects from statins, aren't there?
Yeah, let's see.
Muscle.
About 10% of people have inflammation of the muscles that results in pain. A couple percent that's so bad they have to quit it. And if you do muscle biopsies, you find muscle damage from statins in 70% of people. That's 70. You find evidence of muscle damage from statins. What else do they cause? Well, the muscle damage is the biggest thing. Okay, so they hardly at all work. The ones, the PSK9, whatever they're called, the new ones that come out, that cost you $10,000, $12,000 a year. You have to get 2 shots a year I believe they're injections. Twice a year. They're like $10,000 to $12,000. Those drugs have not been shown to reduce the risk of dying of heart disease.
And they just started using them. I mean, what about 10 or 20 years from now when they discover, oops, we made a mistake?
Still doesn't work. And plus people are getting all kinds of, yeah, that's a problem. And then you go on to other things like, I forgot the name. There's some, well, I think probably if you just want to see your numbers get better, which I know is important to a lot of you, because you know you make or break your day based upon these numbers. If what your goal is, you're honest with yourself, and all you care about is having better looking numbers, then take berberine. Berberine is an herb that you buy over the counter at Amazon, which has been shown to reduce cholesterol to the same degree as powerful cholesterol-lowering medications. All these drugs lower blood cholesterol. The numbers look better, okay, because they inhibit the formation of cholesterol. But they don't fix the problem. The problem is toxicity from food poisoning. And there are so many things about the food that damage the arteries. It's not just the cholesterol. It's not just the saturated fat. It's not just the inflammation that occurs. You know, there's not the lack of phytonutrients. That's it. When you bite into a potato, you're biting into 50 different ways that the food helps your arteries. You bite into a statin pill, and you're lucky. You know, basically all you've done is you lowered a number, so you die with better looking numbers. Big deal. And your doctor is less likely to get sued because he or she did everything possible for you. You know, that's the way medicine's practiced. If you die with a bunch of bags full of drugs next to your bedside, the family says, oh, the doctor was so good to my mother and my sister. Look at all, he did everything. Look, you got a tube going down their throat, another one in their nose, a couple of IVs, catheter in their bladder, 15 different types of pills hanging around, 3 or 4 IV bottles. And you walk in and go, look at all the treatment, and then you get the bill. You got to pay for this. You know, hundreds of thousands of dollars for treatments that we know that we don't know they don't work. We know before we go in they don't work. But there's always that one case. There's that one exception. We got to try. Besides that, there's a whole bunch of money to be made by the pharmacy and the X-ray department and the hospital to keep the doors open. Gotta try.
Oh, please don't do that to me.
You know, believe me, I won't. We used to go, when I was a resident and an intern, I spent over 3.5 years in postgraduate training after medical school. One of our jobs was to attend code 500s or code blues, where people would, their hearts would stop, you know, and would be called on code blues for people with terminal cancer. I mean, it's just ridiculous. But I think back, I can only remember one person in 3 years, and I would get called out several times a week. One person in 3 years that made it out of the hospital after a code. The other 100 never made it out of the bed, but they got a big bill for it. Believe me, a crash cart team is very expensive.
Okay.
How did we get there?
I don't know.
Who knows?
I don't know.
All right, next question. This is from Johnny. He says he's been eating a lot of rice and now he's getting a little worried about arsenic. Should he be?
Yeah. Well, it depends on where he buys his rice from. If you buy your rice from the area of the country known as Louisiana, Mississippi, maybe Georgia. If you buy your rice from that part of the world where they used to grow cotton and they had infestations with boll weevils, you know, these bugs that eat cotton plants, and they went out and killed the boll weevils with arsenic. So the arsenic ended up in the soil. And so if somebody comes along and grows rice in arsenic-laden soils, what do you expect? There's nothing special about rice. They call it a hyperaccumulator. You know, this Consumers Reports, who did this article that got national attention on rice and arsenic, they did a report the year before that showed there was more arsenic in infant fruit juices than in rice. And you want to talk about hyperaccumulators. In other words, plants that suck poisons out of the soil, thallium, selenium, you know, all these different poisons that give you cancer and kill you. We want to talk about hyperaccumulators. Those are the cruciferous vegetables.
Yeah, we tell people to eat those.
I know, it's crazy.
Yeah,
But we don't tell them to eat a lot of them.
that's true.
Not like some people do. But you know, if you're going to worry about, I've never seen a case of arsenic poisoning or thallium poisoning or cesium poisoning, or I've never seen it. But I've seen people die from lack of rice. From rice deficiency, I've seen thousands of people die that I wouldn't have seen if I was practicing in a rice-eating country like China or Thailand, Vietnam. I wouldn't have seen heart disease back when I started in school. I would not have seen breast cancer. There was a group of women in Japan that wanted me to give a lecture to their group, which is women who develop breast cancer. But they were all after World War II because they didn't have any mothers or grandmothers who had even heard about breast cancer. Of course, after World War II, the Japanese changed the American diet. And that's why. So anyways, if I was practicing a part, can you imagine if I opened my doors in China, in rural China, and I advertised, we give half price Ozempic, Wegovy, Zepbound, half price. I'd go broke. Who would want to buy it? In rural, I don't know, things are changing so fast that maybe they would.
Well, not in rural areas, I don't think.
Anyway, should you worry about, why don't you buy rice from Asia? They didn't pollute the soils with arsenic, or there are also some California rice companies that have paid a lot of attention to making sure that they have a small amount of contamination. Eat the rice.
Thank you. Next question. This is from Betsy. What causes high bilirubin?
Most commonly, it's due to something called Gilbert's, Gilbert''S. It was a guy named Gilbert. This is the most common cause of elevated bilirubin, and it's a condition that is not a disease. It's a variant. After people fast, overnight, which you do before you get your blood test, in a certain segment of the population, those who have Gilbert's, their bilirubin goes up. And then after they eat, particularly if they eat carbohydrates, the kind of diet we recommend, the bilirubin goes down. The other thing, the way you decide that this is just Gilbert's disease and not some more serious liver disease, is you check the other liver enzymes, the ones we talked about with fatty infiltration, like SGOT, SGP, GGT, there are a whole bunch of them, liver enzymes. And you check those, and if they're abnormal, along with the bilirubin, then you probably got a problem. But isolated elevated bilirubin is not a problem. It's not a disease. It's called Gilbert's. Look it up. I hope they all go home after this 5 o'clock session and get on the computer and look at all these things. Because I worked really hard to put those references together for you. You know, the selection bias is only in quality of studies and what I believe is the truth. And I don't think I gave you anything but the majority opinion. I will defend my point of view with anybody, anywhere, anytime, any place. As long as I don't have to travel. I've done enough traveling.
Well, I know
On
lots
Zoom.
of people tune in after and watch the recorded version, but it's so great because you can stop and pause and go back and look at, you know, all of your references. So we appreciate
They're
it.
all there. That's why I put them. I put them there for you in the right-hand corner of the slide. I expect you to look them up. I've also told you how to get articles that you're not allowed to have. Okay, that are copyrighted by various journals. I know how to get them free. You go to a website called Sci-Hub, SCI-HUB.org. And what you'll find is that,
.org?
oh, yes, no.
I thought it was .ca or .r.
Oh, yeah, it's right, it is. Russia or
Yeah.
Siberia. You're right, thank you, Mary. So it's just look up Sci-Hub. And they're a group of people who, they haven't been updating it lately, but the research done back 100 years, up until 2022, or maybe 2021, they have copied the papers and made them available to the general public. And their attitude is, and I agree with it, is these are your articles. You paid for them. You paid for them either by products that you bought from these companies or by various grants that were given due to your tax dollars. You paid for them. And that's the attitude that I take and you take. So Sci-Hub, go to Sci-Hub.Siberia or .Russia or whatever it is. They changed their location. And
I put the link in the
article.
chat. I think it's .se now. So
Yes, I think that's Siberia. And they moved. It's a great site. It's a great site. You know, if we were talking about a used car or a new refrigerator, and you were going to go out and spend, you know, $5,000 or $50,000 on one of these items, wouldn't you do some research? You know, if somebody's asking you to buy $100,000 surgery, or to be on a lifetime of diabetic medications, which, by the way, the average person is $23,000 a year to take care of a diabetic.
Yeah, but they have insurance, you see, so they don't think they have to pay for it.
You pay for it eventually. You pay for it. Anyway, why wouldn't you take the trouble to look into some alternatives? And I know it's hard. I really do. The first thing you got to do is you've got to get some time to think about it. You know, if you're in a situation where you're being pressed to accept a certain type of medication or treatment, you say to the doctor, I'm getting out of this office. I'm getting out of here to think about it. At least a prisoner gets one phone call, doc. Give me a break. I want to go home and ask some people about it. I want to redo a little research. I want to see who's telling me the message that would give me more good than harm. That's what you want. You're worth it. You're really worth it. If not, then the person next to you is worth it. Do it for them. Look up the research. Look up the research. Challenge me if I've exaggerated, if I haven't told you the truth. I put out that challenge for people for a long time, 47 years. And not that I don't make mistakes, you know, it's just that they're honest mistakes. And not because I didn't do the work.
We appreciate it. Okay, next question. This is from Johnny. He's wondering if you can talk about using potassium chloride as a salt substitute.
Not a good idea. It's called no salt. That's what they call it in the store these days, you know?
I don't know, I haven't looked.
Potassium chloride. Potassium chloride does not exist in nature, first of all. Sodium chloride does, salt, sodium chloride. But potassium salts are not present in nature. They have to be manufactured. And what they will do is they will replace sodium. They will replace the wonderful taste of sodium with a disgusting taste of potassium. And
It's supposed to taste the same.
but they don't. They taste terrible. It's horrible. And the idea being that salt is the problem. Salt's not the problem. Yeah, you know, if you get to the extremes, it can be a benefit or the problem. But for most people, the salt isn't the problem. It's the bacon. It's not the salt. It's the pig. It's the company that salt travels along with. 70% of the sodium you consume is non-discretionary. You didn't have a choice. It was in the cheese. It was in the products. It was in the meats. 70%. Don't worry about that salt shaker. That's not the immediate response. You get away from the pig and the cow's milk. That's the problem. That's what's rotting your arteries, giving you cancer and diabetes. All right, now at the extremes, I think you can get into trouble with sodium, like around the average American eats 3,500 milligrams of sodium a day. Our diet is about 1,000 milligrams a day. When you get up to, say, 15,000 milligrams a day of sodium, you probably get more strokes. And when you look for benefits,
What would you eat to get that much
they
sodium?
just pour cake salt all over the food.
Oh, okay.
This comes from a study of Korean soldiers during
Okay.
the Korean War. Okay, so
Sorry.
anyway,
Sorry.
you
I
ever heard of
forgot.
Look, just get the food straightened around. If you're not enjoying the McDougall diet, it's because of the salt. Put salt on the surface of the food. You'll love it. It's the salt you're missing. You
And
know,
potassium chloride
Oh.
can be dangerous in
it
large
can be, it
amounts.
can be. I just have to refer back to one of my patients who had a heart attack, and I sent him home, and his wife decided to go potassium chloride, and she made him spaghetti sauce that night with a half a box of no salt. She put him in the hospital. He had a cardiac arrhythmia, almost died. Be careful. That's not good stuff. Doesn't taste good, not worth your trouble. It's treating an enemy that's far less of an enemy than you were taught to believe. Salt is it's not a major food poison. Let's just put it that way. It's better to eat a low salt diet. And again, it's part of the way I was trained. It's my bias. I'd like to get rid of some of that bias. I think I have, but not all of it. So you're still stuck with me telling you it's probably a good idea to lower your salt intake, but not to the point where you don't like the food. Don't eat the pig.
Thank you. This next question is from Alona. She wrote in and she's wondering if you can talk about why oil is toxic.
Well, oil, first of all, it does not exist in a free state in nature. In other words, there's no oil present as oil without causing some type of processing to take place. Even if it's a grinding stone that they used to use in olden times to crush olives. You have to crush the olive to squeeze the juice out of it, which is the oil. And the more intensely you crush it and purify it, the more it's oil as opposed to its original food. That's why, there's some argument that eating old-fashioned type of olive oil with a lot of the ingredients still visible might not be so bad. But this highly processed stuff, I'm not making that argument. I want you to stay away from all of it because the fat you eat's the fat you wear. Anyway, it doesn't exist in nature. You have to go through processing. When you make oil, you leave all the good guys behind. Like with corn oil, you leave all the corn protein, all the corn vitamins, all the corn minerals, they all get thrown away and you're left with corn oil. That's it, just corn oil. And there are thousands of phytochemicals that interact to make that oil safe. So that when you eat it in its natural package, say the olive or the rice or potatoes, whatever, it's mixed up with ingredients that make it not only safe, but healthy for you. And why do I know that? Because I believe nature did it right the first time. You know, I have to resort to some beliefs that may be beyond proof of science, and that's one of them. So anyway, what does it do? Well, the oil causes nutritional imbalances, and this increases your risk of cancer. There's certain oils that damage the arteries. These would be your quote good oils, like your omega-6 fats, which are corn oils. You know, they're very toxic to the arteries. There are some oils that aren't real toxic to the arteries, which may actually reduce the risk of dying of heart disease. These would be your omega-3s, your fish oil, your flaxseed oil, but they increase your risk of bleeding. Yeah, what do you want to be? You want to be shot or you want to be hung? You want to die of heart disease or you want to bleed to death or die from an infection? Because these omega-3 good fats, they suppress your immune system. You should eat the oil that's naturally present in the food. Rice is 8% oil. Corn is 10%. Oatmeal 16%. Potatoes are 1%. Sweet potatoes are 4%. So there's always enough fat, always in whole food to meet your needs. And there's no such thing as fatty acid deficiency under any normal
They're
circumstance.
not worried about that. They're worried about how do they cook without putting that glob of oil in.
You can tell them how to do that, Mary.
Well, you don't need the oil. You just put the vegetables in the pan, add a little bit of water or vegetable broth,
Yeah.
and cook them that way. But you don't need to add the oil. You don't need to add the oil when you bake.
But that's not the way cooks have been taught.
No, of course not.
You know, every recipe, and I get up a little earlier than Mary does in the morning, and I go through the various newspapers that I read, and I send her recipes that I believe can be easily converted to our style of eating. And she comes through almost every time. But every single one of these recipes has oil in it.
Oh,
It just plain and simple. People think you can't cook without oil. And it's the point now where most of you who have been following the program find oil disgusting. You know, what do they call a restaurant with a bad reputation? A greasy spoon. What do you do if you get oil on your hands and face or the kitchen counter? You get out the strong detergents and you wash it off because it's disgusting. Don't eat it, except in its natural state, where it supplies essential nutrients in just the right amount.
Thank you. We've got 2 minutes, so I think we can fit this one question in. What would you do about an aneurysm?
Well, likely it depends. The general rule, I think they're talking about abdominal aortic aneurysm, which means an aneurysm occurs somewhere between the heart and the belly button. But there are aneurysms on many other arteries too. You follow the growth of the aneurysm with an ultrasound. You know, doesn't hurt much, no radiation problems with an ultrasound. And when it gets to be 5 centimeters, I think that's still the rule, 5 centimeters in size, then what happens is the benefit of surgery outweigh the risks of surgery if it's 5 centimeters or bigger. That's the rule that's used. So would I send somebody off to surgery? Well, with some hesitation, yeah, but I probably would. You know, it depends on how likely I have seen. Mary, I don't know whether you remember this outside of the Honoka post office. Paul Matsumoto and I grabbed this guy out of a car, took him up to the hospital. He was dying from a ruptured aortic aneurysm. Paul was one of the greatest surgeons I'd ever met. We flopped him on the operating table, sliced his belly open. Paul happened to have one of the grafts for abdominal aortic aneurysm. We sewed this mesh graft in, and this, I'll never forget that. Wow, I want to tell you, I had an amazing background training.
Yes.
I learned a lot. But anyway, yeah, I would probably operate on it. Would I ask them to change their diet? Are you talking about pre or post-operatively? What do you think?
Both.
Both. Heather, why don't you tell them about this class you got coming up? And you also have some, you have a 12-day program that a good share of these people really need to get involved in. I mean,
So we've got lots coming
soon.
up. We have a 12-day course starting March 8th. We only have a few spots left, though. We only have 4 spots left.
oh.
But after that, we'll have another course.
She'll sneak a couple extra people in. Don't you worry. You won't do it. Okay. I'll bug you, Heather. They're these very deserving people. I'll bug you. All right.
We
So
also
we're
have
gonna be full.
a new mini course coming up on the digestive system. So we're going to go through, from the lips to the other end, and we'll be starting that in April. So I'm really excited about that. And then we'll be here every Sunday night at 5 p.m. Pacific.
I thought you were going to do one on dementia.
Oh, I shared the link in the chat about purchasing the mini course for 25%
Oh, I see.
off.
This is, I'm not going to do this live. This is a mini course. I got
This
it.
is a
Oh,
mini
well,
course,
I did a good job on that one.
You did. So if anyone wants to learn more about Alzheimer's, dementia, the link between diet and aluminum, you can purchase the mini course for 25% off.
All
And
right.
then we'll see you all next Sunday at 5 p.m. Pacific.
Yes. Yes, we will.
Okay,
Anyways, it was fun.
it was fun.
Yeah,
That was a
we weren't
great
sure.
hour.
We weren't sure at 4:59 whether it'd be fun or not, but it was fun. Thank you,
It's
guys.
always fun.
It's always fun.
That was great.
All right.
Thanks everyone for
See you
tuning
then.
in. We'll see you all next Sunday at 5 p.m.